So this webinar is being recorded, and I'd like to welcome you towards a safe, secure, and sustainable reusable PPE system in Canadian healthcare. If we mention any products or company names in this presentation, it does not reflect or imply an endorsement of any sort by the coalition. Please do your own research to investigate the products and companies of interest. So a little bit about the coalition. We're a national not-for-profit working in healthcare organizations, and we lead the transition to sustainable climate resilient practices. Our project for this, if you have not been around for the last year, it's to demonstrate that hospital-generated PPE and medical single-use plastics can successfully be managed by applying the principles of circular economy, by reducing, reusing, and recycling as much as possible before the materials are disposed of. So in today's discussion, we'll be going through what steps we took in our project, the examples of circular economy practices in PPE, what we found, and then how we can work towards a reusable PPE system for healthcare, and what some of our recommendations for next steps are. So the Government of Canada has a particular interest in reducing fossil plastics. So the goals and objectives from moving towards zero plastic waste by 2030, reducing microplastics in the environment, greenhouse gas emission reductions, and supporting circular economy initiatives are in particularly have been brought to light after the most recent COP regulations. So to tell you a little bit more about what we've done, we've established a steering committee, we've done a literature review, we've identified circular economy practices for PPE. In our discovery stage, led by Katie Cowan, there were 7 roundtables and discussions. We've looked at PPE products of interest. We've undertaken 3 surveys, the first being through healthcare facilities from a facility-wide perspective on medical single-use plastics and reusable PPE. We've done another survey specifically for the healthcare workforce on their experiences with reusable PPE. And then we've also done a survey for PPE related businesses. We've taken the time to estimate quantities of PPE usage. We've developed an actor map of PPE gown usage and reuse in healthcare facilities, opportunities for reusable PPE systems in healthcare. We've identified quite a few sources that we'll be going through today with you, and we've created a video as well. Thank you to our steering committee, Katie Cowan, Leslie Ann Hurst, Ed Rubenstein, Patricia Trovovic, Fiona Miller, and Marianne Dawson for helping us with this throughout the year. This is a thank you to the coalition project team. So to get into the details of the steps of the project, the first aspect that we went through was with our partners at the Center for Sustainable Health Systems at University of Toronto. They helped us conduct a rapid review and an environmental scan of the sustainability opportunities with PPE and medical single-use plastics. It's currently available on our website, so if you want to take a further in-depth look at it, you may there. And we'll get started on the circular economy practices for PPE. There are 3 key practice principles of the circular economy. It's to design out waste and pollution. It's to keep products and materials in use, and then it's to help regenerate natural systems. On the slide, the top arrow, which is the red arrow, is to represent the linear health system. And it takes it from single use, from material extraction, all the way to waste disposal. However, our project focuses on circular healthcare. So this is what circular healthcare can look like for PPE. We're going to start off with prevention, because if we can prevent PPE from being used, that is the best way to ensure that there is less PPE waste in the system. So something something to consider is, how are we addressing the social and ecological determinants of health? Moving on, if we can't prevent, then let's work on product redesign. So how are the products being designed? Are we using plant-based masks and gowns? What's the packaging looking like as we're bringing these products into our healthcare systems? That's what we have to consider as our next step. If we can't redesign the product, then let's work on on-site reduction. So these are conservation strategies for PPE. For example, the Gloves Off campaign by the NHS in the UK, that is a way to reduce the usage of PPE. We then move on to reprocess and reuse. So how can we reuse the products that are already in our systems? Reusable gowns are the perfect example of this. It's a way to disinfect, keep our healthcare workers safe, and then consistently be able to use this product without putting it into the waste stream. We're moving on to repair and servitization. So repairing surgical gowns for greater use, leasing reusable gowns are both ways that we can consistently keep the same products, not compromising safety, but keeping them in the system. After they're done with their life cycle as a gown, is there opportunities to repurpose them? Make new products from the end of life, potentially shoe covers. And then if we can't do any of the steps that I've outlined above, then how do we recycle these products? Mechanical recycling or chemical recycling are two options available, but these are all steps that we can take before we even get to recycling of the gown. And by doing all of these, we can continuously keep products in the system for longer, benefiting our environment, and ideally making it more cost effective for the systems themselves. The next stage that we worked on was the discovery stage. And I think some of you folks who are attending this webinar today participated in that, but we held 7 roundtables with 57 participants from all across Canada, from many different sectors, businesses, healthcare, laundries, waste management. Everyone was included in these roundtables. And what we did was we created 4 scenarios for how PPE can be managed in the healthcare systems. So the throw it all away, which is the base case, the industrial recycling, which has disposable option, prevention includes reduce and redesign, and then prolonging service, which is the reusable option. And we just wanted to highlight some of the key insights that we found during our discovery stage, which is that it was surprising to a lot of participants that reuse was the least expensive option. It didn't seem like that was the case. And then it was also surprising to learn how many reuses each item can withstand. These are reuses that have been identified through IPAC, through safety protocols. Lastly, reusable PPE standards need to be clarified for people to be able to understand and educated on what options are available to them. And then to ensure that reusable PPE would be safe after processing it. Without the education of how this process is done, it makes it more unsafe, or at least it gives them that perception. So something else that was really interesting is that we asked each of our participants what PPE we should prioritize for sustainable improvements. The top 3 were gloves, masks, and gowns. What's surprising to almost everyone is the fact that gloves, which are notoriously difficult to improve sustainability-wise, is the one that most people want to tackle. And it's amazing the fact that this quote from the manufacturer's insight, which is, we've probably created more innovation in PPE in 6 months than has been created in 65 years. All of these issues that have been mentioned so far, such as the requests for comfort and safety, and all of that, we have solutions to every single one of them. And that's a bold statement. So there is innovation happening in the manufacturer side, and there is a want clearly defined from healthcare workers. And together we have to bring it together, quite honestly, to move forward. There's something that's got to change where we're working together towards this reusable system. So the PPE that we focused on for our project are medical grade surgical masks, filtering face piece respirators, reusable elastomeric respirators, goggles, gowns, gloves, and face shields. PPE and plastics that were so this is, so sorry. So from BC Green Care, we have access to this waste audit that was done pre-pandemic. In here, we've clearly identified that PPE is a different waste stream, which other hospitals and healthcare organizations may not have done in their previous waste audits. But we want to show that PPE is a significant portion of your waste stream that's being created. It might look a little different now because there are options for recycling of PPE that weren't available before, but it's still a significant component of the hospital waste. So in this section, I'll be going into the 3 different surveys that we've done. We'll specifically be looking at results from 2 of them. First, we'll begin with the Green Hospital Scorecard Survey, which included a circular economy section where we asked hospital facilities questions on their reuse, reduce, and recycling practices. So one of the first questions that we asked was, does your facility use reusable gowns? As you can see, a majority said yes, they do. And if they use reusable gowns, where is your laundry service? Again, the majority of facilities have offsite laundry services that help support them. This is notable because reusable gowns are considered low-hanging fruit. And it's also the most easy way to get into reusing opportunities within your healthcare system. So from that same question thread, we asked what percentage of usage is reusable? And not only are a lot of hospitals using reusable gowns, but a majority of their gowns are reusable. Then we move on to policies. So do you have a reusable policy? Although a majority said no, they don't. Their interest in learning more about reusable policies is there. So it shows that there's a want and a need for education in these types of topics. In here, we'll go into have you implemented these practices? So virtual care, choosing wisely, reconfiguring custom OR kits, and glove use reduction. So these practices can all involve reduction of PPE, either through prevention, such as virtual care. You don't need to use PPE if you are talking with your patient online. Choosing wisely, which is a optimization tool to use to reduce the amount of PPE that you are PPE and single-use plastics that you're using as you interact with your patients. For reconfiguring custom OR kits, it's again that same reduction conversation. And then glove use reduction would be to eliminate how much gloves are being used per interaction with your patient. Moving on to the second survey that we've done is with the healthcare workforce. Now, this healthcare workforce, there was a lot of what I want to show here in these 2 graphs is that we had coverage from almost every province or territory across Canada, even if it wasn't to the grandest magnitude. We had quite a bit of turnout. And for most of these workers, they were mainly based in hospitals, but there are people who were in long-term cares, dental clinics, medical clinics. So it shows you the breadth of interest that folks have in this type of project. So one of the questions that we asked was, how safe do you feel with each type of PPE? With reusable gowns, goggles, and face shields, very safe is the standard. However, with reusable elastomeric respirators, which are newer to our healthcare workforce, there's some optimization concerns. There are some concerns that we have to address before workers feel safe incorporating it and feeling incredibly safe in those, but that just means that there's something to work towards. Similarly, with rating the level of comfort that each type of reusable PPE brings, reusable gowns, goggles, and face shields are all very comfortable. Again, with the reusable respirators, you can see the fact that most people did not have it applicable to them. And on top of that, there were about an even source of distribution for how they felt in the reusable respirators. So it's something to work towards. And then we wanted to ask each of the healthcare workers that did the survey is, how important are the following factors regarding your use of PPE in relation to this same type of PPE, which is disposable? What's important to note is that safety and meeting standards are the top two priorities, which makes sense. But almost everything else is falling in quick succession. So the factors such as reduced waste, ability to speak, the reduction in single-use plastics, those are all factors that are important to healthcare workers as well. And notably, made in Canada and cost effectiveness are a little less important. But that means that this is of interest to healthcare workers. And they want to see these types of practices and these reusable PPE to exist as we go forward. If you're using a reusable respirator, elastomeric respirator, what's the satisfaction level with it? A lot of people really like the fact that there's confidence in the cleaning of the reusable elastomeric respirator. However, as you can see with the information and how it's kind of leveled out in each of these factors, there is work to be done to make them more optimized for healthcare worker usage and to incorporate it in a greater capacity in healthcare systems. This slide right here, we have who uses reusable elastomeric respirators and where are they being used. It's being used across Canada. That we can clearly tell. And it doesn't really matter where in Canada it's being used, but it's being incorporated in all different provinces and territories. And the folks that are using them, their job titles are very notable as well. Like, it's not just based in healthcare facilities. Dentists are using it, nurses, anesthesiologists, respiratory techs. Everyone is using it throughout the system. In this slide, we talk about the fact that 3M, Dentec, Honeywell, and MSA are the types of respirators that were most used. But what's notable to say about that is the fact that a lot of folks did not know where their respirators were from. And there was quite a variety of the types of respirators that were being used. So there is still work and optimization that has to be done to make this more acceptable to healthcare facilities. But although hospitals were the majority of users, dental clinics, long-term care, and emergency medical services also used elastomeric respirators as well. And in this slide, we just want to touch on the fact that when we asked folks if they would continue to use reusable PPE after the pandemic wanes, without a doubt, people said yes. The only question was the reusable elastomeric respirators, which again, it's the majority, it's not applicable for them. And then the folks who did use it, there's more, it needs to be optimized so it can be better used for healthcare workers. In that, and with that, I'll be passing it off to Linda Farangu, who will be talking about the estimating quantities of PPE plastic waste.
Excuse me. Hello, folks. It's Linda Farangu. I'm the project lead for this project. I'm also the senior advisor on climate change for the Canadian Coalition for Green Healthcare. And thanks so much for joining us today. So one of the objectives of this project was to see if we could estimate the quantities of PPE waste generated during the pandemic. And this information on this chart here shows that what kind of information was currently available when we started looking at this. And so we saw some international numbers of how many tons, millions of tons per day were being generated globally. The World Health Organization reported that of the material that they provided to the countries in need, of the 87,000 tons they provided, they estimated that 37,000 tons were actually non-essential PPE. And so their determination on that was that about 40% of the materials that were being generated really didn't need to be used. To find out a little bit more about healthcare plastic waste, the US, there's an estimate that in the health system itself, about 25% of the waste in the hospitals are plastic. The NHS in England identifies that of the waste produced per day, it's about 11,300 tons, with about, again, a quarter of it being generated as a plastic component. So we're seeing similarities in those kinds of numbers. In Canada, we have information on the waste plastic that's being generated per year, and that's over 3 million tons per year. We don't have information more specific than that, for example, into the medical plastics or healthcare plastics. But we do have an estimate from Health Canada where they identified that about 63,000 tons of PPE waste would be generated in the first year of the pandemic. So those are kinds of the information that we were starting out with. And there were various data challenges, as you can may imagine, when we tried to actually access information on here. We were in the middle of a pandemic, don't you know? So getting access to healthcare workers was really quite difficult. There was also challenges in government data. And so when I'm talking about government data, for example, Industry Canada reported information on imports and things like that. They didn't really identify specifically enough that something was a PPE material. We had some great support from Industry Canada staff trying to work with us to identify what these were. And clearly, the way the system is set up, it wasn't specific enough. Yet I could go to the US database and look up imported PPE, and that information was clearly identified. So there's some challenges on the data side to allow us to actually get this kind of information. We also know that there was a mix of disposable and reusable PPEs used by hospitals during the pandemic, and that these could change in the middle of the pandemic. Some of the hospitals we talked to in the middle of the pandemic went from disposable to reusable gowns. It actually was a more resilient opportunity for them based on the supply chain issues. And we couldn't really get the information from the businesses because they don't disclose their sales data. Guidance on PPE use actually changed mid-pandemic, so that kind of changed the situation going forward. And PPE was actually purchased in several different ways, or it made its way to hospitals in several different ways. It could be through federal purchasing or provincial and territorial purchasing. It could have been purchasing by the hospital themselves, donations to the hospitals, that kind of thing. So the information was all over the place, and it's just impossible to actually get it together. In addition, where we had information that was reported per year, it didn't really mean that the information that was reported on purchasing in one year was actually going to be used in that year. So we had challenges in identifying the actual years that different things were being used. So as we as the project kind of started to wind down, we had some great opportunities on information that was starting to be provided by the various levels of government. So in Ontario, they provided information on their PPE purchases. And so we were able to use that kind of information in our estimations. We also had information from the federal government who purchased materials to distribute across the provinces and territories. And so we could use the kind of information that's shown on this chart here as well. And we also started to see government auditor reports. Ontario government, Ontario Auditor General reported on value for money, the COVID-19 personal protective equipment supply. We had a report from Quebec that came out recently identifying quantities that were purchased as well. And we had the federal Auditor General reporting on personal protective equipment and medical devices. And yet, again, it's not information that's being reported often in the way that we needed it. And so we had to make do with the information that we had. So what did we find? So here is a sample of Ontario disposable PPE waste and the possible impacts of that waste. So we see here that of the materials that were being purchased that they were identifying for us, the FFP respirators, surgical mask, gowns, gloves, and face shields. We had quantities for them. We converted those quantities on based on the weight of each of those and came up with tonnages for each of them. So from the gowns and the gloves perspective, those were the highest in terms of weight generated. And similarly, in the greenhouse gas equivalents that were generated, it was gloves and gowns as well that were the highest ones. And we came up with total values of close to 8,000 tons in weight and between 67 and 68,000 tons of greenhouse gas CO2 equivalents. Information on the Quebec disposable PPE waste impact was also made available through the auditor's report. And again, we took this information, converted it to weights and greenhouse gas equivalents, and found, again, that gowns and gloves were the highest quantities. We didn't have information on face shields. For tonnages, largest quantities, as well as through greenhouse gas generated on gowns and gloves. Again, fairly significant. And total quantities of over 28,000 tons in the first year of weight, and almost 250,000 tons of CO2 equivalents. From the federal purchasing side, we took again their estimates on the materials that they were reporting on. They didn't report on surgical masks that we found. We know that they had provided these to provinces because we found the information in the auditor's reports, for example, but couldn't get that information for this particular analysis. So I just might add that this is 2 years worth of pandemic purchasing, as was Ontario, and Quebec was just 1 year worth. So again, we made those conversions to weights and tons of CO2 equivalents. We're finding again, gowns and gloves, the most significant contributors. And then we added them up, not that we should, because we're missing a lot of data, but we wanted to see ballpark, what are we talking about in terms of total waste? So of the waste that we identified in this small sample, over 75,000 tons was identified. Now, this is more than the 68,000 tons that was identified by Health Canada as a possible sample weight that might be generated. But all the information was not available to them when they made that estimate either. So we still have data missing from the rest of Canada, other sources. We don't have PPE purchases, for example, that didn't meet medical device standards that had to be either disposed or given to others that didn't need medical grade materials. There's a whole bunch of things that are missing here. But if we can look at this for a second and say that across Canada, Ontario and Quebec together is 50% of the hospital situation. If you add up the total number of beds available, it's Ontario and Quebec that compose 50%. So if we took their values and doubled them, you know, we come up with a fairly much larger number than what we have here as well. this is just really to give us some ballpark information on where we're headed. So what does this mean on the slide beside this? If we look at what it meant in Ontario, of the total waste generated of the healthcare waste, if we made some estimates there, it would be about 5%. Now, we used a calculation of 6 kilograms per bed per day as a way to estimate the waste from hospitals here. And that may not have been the case during the pandemic. We had a lot less OR activity happening, and the OR is one of the largest contributors. So that's ballpark. We're talking ballpark here. And in fact, the World Health Organization has also identified that there's these sudden volumes and increases in healthcare waste, identified all sorts of cracks in the waste management system in the healthcare. So let's look at the sample greenhouse gas emissions. And we've come up with a total of 616,000 tons of CO2 equivalent for the combined 2- and 1-year data that we have. If we were to look at that again as a 1-year estimate, and yes, you can't add 2 and 1 years together, but this is the pandemic and things were crazy, so we did that anyway. And we came up with a 1-year estimate for Canada of 308,000 million tons of CO2 equivalent, which if we go back to what has been estimated as the healthcare component of greenhouse gas emissions, which is 33 million tons, it's about 1%. And again, this is probably a very, very low number, low estimated number. So we have to be careful in how we use these, but it's giving us ballpark ideas. It could be 1, 2, 3%, but it's in that range. Similarly, NHS England, we had some information there, and we estimated that for them, it was about 0.4%. So we're in the ballpark of what's happening internationally. And so how did we generate that information on the greenhouse gas equivalents? Well, there's a study out of the UK that did a life cycle analysis on the various PPE. We used the information that they provided in their LCA on how much carbon footprint is each of the individual PPEs. And so we took that. It's not totally applicable to Canada. The situation is going to be different. The type of gown, they have 1 type of reusable gown. We have 2, isolation and surgical. So it's a little bit different, but again, it's ballpark. So we also created an actor map to find out who are the actors involved when we're talking about the PPE gowns in healthcare. And I know you can't see the details in this one, and we're going to be making it available so you can take a closer look at it later. But it's important to identify who the actors are when we're talking about the PPE system in Canada's healthcare. And thanks to Azara for pulling that together. So let's look at some of the opportunities for a reusable and circular PPE system for healthcare. We understand that there is the possibility of reducing non-essential disposable glove use, and that has been clearly done in the UK. It's really promoted by the nurses associations there, and they've seen incredible success in identifying what is non-essential. And so I think that's an opportunity for us to incorporate here in Canada. Face shields, reusable face shields, they're actually being reused through the pandemic in many places, and it's something that we can continue to look at. Goggles were also being reused throughout the health system during the pandemic. Surgical masks, disposable, medical grade surgical masks, generally disposable. We do have available now in Canada a plant-based medical grade surgical mask, which is awesome, so we won't be relying on fossil plastics. The opportunity here, though, is to identify a reusable plant-based medical grade surgical masks. Along the respirator side, we started off with the traditional N95s, but we knew that there was reusable elastomeric respirators being used south of the border. And in fact, that's what started to happen in Canada during the pandemic when the N95s became very unavailable. We also know that it's possible to make these reusable elastomeric respirators a lot more friendly as well, perhaps plant-based filters, perhaps making the respirator itself a little bit more reusable or long-lasting. And on the gown side, we know gowns were being reused with the reusable systems. Can we develop plant-based reusable systems? And then at the end of life, perhaps compost them. So those are some options there. So in addition to identifying what some of those options were, we also need to consider the concerns that we had during the global PPE supply chain issues. There was low availability of disposable PPE. There was limited manufacturing capacity, and most of that was in the China and US. Canada started doing some manufacturing early on in mid-pandemic when that was being encouraged. Raw materials were also from overseas. There was concern for PPE worker conditions overseas. And the quality of the PPE in the products often or sometimes did not meet Canadian medical device standards, so they could not be used once they were purchased. And on the other side, we also have price, huge fluctuations in the price initially of the PPE. And you can see from this graph from the Quebec Auditor General how the PPE price fluctuated from when the pandemic started in the first year, reaching its heights in May 2020. However, we have some opportunities here. We have an opportunity in the reusable gown system, which BC Green Care estimates it's 9 times cheaper per cost for use of the disposable gown. And we have identified, they have identified $2 million in savings over a 6-month period, plus savings in disposal. And UHN, who switched to reusable gowns, identified 60% in cost savings. So there's also financial opportunities here. So what we have done here is to identify what a safe, secure, and sustainable PPE healthcare system in Canada could look like for gowns. So let's work through this a little bit so you can follow the train of thought here. Let's start with the green hospital as where the user is working. And let's understand that this PPE that's being made in Canada now through a domestic net zero manufacturing facility is getting its raw material supplies for its sustainable packaging and for the manufacture of its gown domestically. Let's say that we have zero emission vehicles used in the distribution of these materials. So this is the outside of the sustainable healthcare system for PPE. What the inside would look like for the user. The user would have a reusable gown. So the reuse is the arrow that's denoted around the gown, meaning it's reusable, and it's surrounded by plants. Whoops, go back up for a second. It's surrounded by plants, identifying that it's a plant-based reusable PPE gown. The reuse happens either on-site or off-site, and it's being cleaned and disinfected, and it's being used again. If there's a repair that needs to be done, it's being done, and the gown can be used again. Can there be repurpose of this gown once its life as a gown has expired? Can we use parts of it to make, for example, boots? Or can we use parts of it to make waterproof bedding that would go underneath pediatrics in the hospital or something like that? Let's be clever and see if we can identify how we can repurpose that. When all of those options have potentially been worked through, we can take that waste, we can compost it, and it becomes food for growing or dealing with our domestic supply of raw materials. So this is what we're proposing in terms of what a safe, secure, and sustainable PPE system might look like for gowns in Canada. It's a dream, but I think what's interesting here is that there are lots of components of that dream already available to us. We have the Glove Awareness Week that is demonstrated in the NHS in England on how they've reduced their unnecessary glove use. We have reusable surgical masks. They're currently being used in the NHS in England. Revolution Zero is the company that's making them there. We have innovations on reusable elastomeric respirators. There's many varieties out there, but as was shown in our surveys, we need to really look at them and optimize the qualities that are most important for the users. We also know that they're cost effective, they're reusable, and that they have been used for a much longer period in the USA, particularly in hospitals that are dealing with TB infections in Texas. We have plant-based medical grade surgical masks made in Canada. These are available now, and it can take us off of fossil plastics immediately. We have increased domestic manufacturing of reusable PPE. That's just starting to happen. Manitoba supported the development of the reusable respirators there. We also have domestic supply of PPE happening in Ontario now, for example, but it's for disposables. And I think what we have not considered enough is the opportunity for reusables in the domestic manufacture. We also have on-site sterilization units that can decontaminate reusable PPE without water. This is a CleanWork system. It's being trialed with reusable gowns, and it has worked with that. For systems, for PPE decontamination systems that can't use water, this might be an option. And we have net zero carbon PPE manufacturing. We have a facility in the US, and we have a facility that's being used by the Revolution Zero in the UK. And we have recycling of used medical PPE. One particular company, Life Cycle Renew in Brantford, has been starting to take that material from hospitals. We have also something that might be of interest to those that have a large backstoring of PPE that is not being able to be used before it's expired. Sterimelt is the company in the the UK that is an on-site unit that can compact thermally and make these polypropylene logs. You can see this is the polypropylene log. So let's look at some of the recommendations that we've come up with. Really, let's take this pandemic and turn it into an opportunity for sharing and learning. We've learned so much about PPE throughout the pandemic. It would be sad to waste all that knowledge. On the purchasing side, establishing a reuse first policy. Let's be consistent with the definitions and labeling of PPE, optimize the purchasing contract, improve the access to purchasing information so we can feed innovations for this, operationalize our emergency stockpiles, including reusables, and let's look at reusable sustainable packaging and request carbon emissions reporting from vendors. On the R&D side, let's look at reusable plant-based PPE gowns and other plastic medical textiles. LCAs, we need those for PPE. We need business cases so we understand them better, and so do our administrators. Can we establish user groups on reusable PPE products? Let's talk about what we learned on reusable elastomeric respirators, for example. And let's have joint healthcare and business councils to actually feed into the innovations that need to take place in healthcare. On the workforce and infrastructure side, and I stress workforce here because reuse means people, and we need to include people in these equations and when we look at what we need going forward. So we need to optimize where we're doing in-house distribution of reusable PPE. Let's look at the PPE laundry facilities. We need optimization here. Many of them couldn't handle the flow through that was required during the pandemic. What do? We need to really look at these systems, and let's look at the quality control and the emission impact. These are questions that come up from the workforce as well. And material reprocessing capabilities. If we're moving forward on reusable PPE and medical single-use plastics, are we able to accommodate the increase in this reuse going forward? And can we develop a net zero operations as well? And looking at compost and recycling service available across Canada, because right now it's not. And now I'm going to pass this over to Autumn, who's going to showcase the beginnings of our video on the topic. So thanks very much, Autumn.
Thank you, Linda, and thank you, Zora, for such an amazing presentation. Like Linda said, I will be showing a short preview of our video project, The Way Forward is Reusable. This video showcases voices of health professionals across Canada speaking on the benefits of transitioning to a reusable PPE system in healthcare facilities. As I said, this is a short preview of the video, and the final version will be shared to our social media and posted on our website in the coming weeks. Also, a little note, we trialed the video before we started the presentation, and it's a little off with the video, but the sound is clear, and that's the most important part. So we hope you enjoy.
Switching to reusables is extremely important in helping hospital facilities and healthcare facilities be more sustainable, because we already use a lot of materials once, single-use materials, and throw them out. And even though there are efforts to recycle some of these materials, recycling is really not going to reduce the overall environmental impact. So by moving to reusables, we can work towards a circular economy and reduce environmental impact. And we've also found that reusables are a more resilient supply chain than disposables.
Our health system has become increasingly reliant on single-use items, including disposable N95 respirators and disposable gowns, all of which create more waste and emissions. As we learned in the early days of the pandemic, this is not sustainable, and it leaves our supply chains vulnerable to disruption. It's a lot easier to scale up your reuse cycles, such as laundering gowns or replacing the filters in your reusable respirators, than it is to manufacture more of something. And of course, it creates less pollution.
So we are creating a healthcare crisis with what we do as healthcare professionals. It is actually an incredible conundrum, and we are all somewhat hypocritical if we do not start to take responsibility for our professional activities, because the amount of waste we generate, if we were to be considered collectively, all healthcare professionals globally as a country, we would be the 5th worst polluter as a country on the globe. I found that shocking when I found that out, and but it makes sense when you think about it, because we generate so much waste.
So this idea that we can just live our lives with single-use disposable things that are manufactured, that consume natural resources, we use them for seconds to minutes and then we throw them out, that is an inherently unsustainable relationship with the natural world. And it is an irresponsible and egregious use of natural resources.
Thank you, everyone. Thank you, everyone, for watching that. I will be excited to share the final video with all of you once it's finished. Now you will have the opportunity to ask our panelists some questions. You're welcome to post your questions to the chat or the Q&A section, which I will read out to our speakers. You can also raise your hand and I can call on you to ask your questions aloud. To start off, I'm going to go ahead and ask our panelists the questions that are currently posted in the Q&A and the chat. Okay, so one of the first questions was from Miles, and he would like to know, why was choosing wisely unavailable?
I can start with that. Hi, Miles. What we do know is that choosing wisely isn't something that all healthcare workers are familiar with. And so if the person filling out this survey was not familiar with it to begin with, then they just didn't answered that it was unavailable to them. They had no idea what it was. One of the reasons we introduced this question to begin with is to see if we could increase the knowledge level of choosing wisely in our community. It wasn't originally intended to be something that was a sustainable issue, but we all on the outside saw that it had some potential there. And so that's why we introduced that question as the first time in our survey.
All right, so another question is from Agnes. She asked, you may have answered this already, but can you speak to how the plant-based medical grade masks are recycled or composted?
Do you want to do that one, Ozara? I can't, you're on mute. Okay, I'll start. So they're currently not, as far as I'm aware. And so we've been encouraging those manufacturer to actually call them plant-based, because if they're not being composted, or then it's difficult to call something when it doesn't have that opportunity to be composted, right? So we're referring to them as plant-based. In the future, there may be an opportunity to move forward on this. But as I showed in the diagram of what a sustainable system could look like, having even plant-based single-use materials doesn't make sense either. We need reusables. And so we started off a healthcare with cotton things. So we know plant-based is a possibility. We just have to use our really highly motivated and knowledgeable innovation teams across Canada to develop these systems. So right now we're calling them plant-based. In the future, they could be compostable. Oh, sorry, do you have anything to add? I don't know. Okay.
Great. Okay, so Mark would like to know, what's the market readiness in healthcare to purchase low impact PPE?
So I was involved, along with perhaps several others in this audience, at a panel that HealthPro put on sustainability. And it looks to me like there's been significant interest to move forward on sustainable products. And this is really an innovation for HealthPro. It really hadn't had its focus there before, but I think the pandemic brought a lot of things into focus, and this was one of them. And so is the market ready right now? I think the market is going to be pulled in that direction. The more group purchasing organizations start to emphasize this, the more hospital people who are involved in those committees start to look and demand those. I think we're on the cusp of something.
Okay, next question. Justin is asking, or saying, hello, we have just launched a biodegradable, recyclable, reusable face shield here in the UK for NHS UK. We would like to see if we can bring our product to Canada for a manufacturer to supply you with our product. Thanks, Justin. This might be a personal communicative question. Justin, we will be sharing our emails on the next couple slides if you want to email us and have a conversation about this. I don't know if Linda, you want to say anything more?
Oh, it's great to have another innovation. Innovations are happening globally, and having a domestic manufacturing, I think, is really important because that creates a more resilient supply chain, as was heard in the video. So yeah, I'd be interested to hear more about that.
All right, thanks, Justin. So Amanda would like to ask, what are the barriers to the immediate deployment of reusable materials?
What are the barriers to immediate deployment? Okay, so what are the barriers to actually hospitals using reusable PPE? That's how I'm going to take that question. So there's, and medical single-use plastics, I might add. So there is the preconception, misconception that disposables are safer. And I think that's what we're starting to show, that that's not the case. We've got a wonderful participant in our video that we didn't show today from BC, from the quality and infection prevention and control perspective, that once it's managed in a proper way, it is totally safe. So we need to make sure that message gets out there. There are still misinformation campaigns out there, perhaps by the disposable manufacturers. So we need to make sure that message gets out there. The other concern is the just-in-time situation that we have for deliveries. That has happened, that's kind of created the disposable venue for products in healthcare. And so with our reusable system, we won't have a reliance on that kind of a system, and we'll have it more locally based. And that's really what we need to gear towards. So those are a couple of the barriers that I can think of. So the safety thing is probably the biggest Azara, do you have any?
I'd also like to just add in the infrastructure. So with reusable materials, we have to also consider more, we have to consider other aspects. Does your hospital facility have enough space to hold this storage consistently? Is there space to not just dispose, is there space and people to help with the reusable process? So what Linda was saying in the recommendations of the workforce, that's a clear indicator of how you need to have a systems-based approach in incorporating reusable materials.
So just to maybe flag something here, we will be also coming up with a guide to introducing a reusable PPE system at the healthcare facility. So that's something that's still in development. So you'll have access to that too.
Great. Okay, so another question. Have the IPAC teams and some health authorities changed their guidelines regarding gloving? At this point, since the start of the pandemic, my health authority requires nurses and other healthcare professionals to glove at all times in direct care for all patients. This uses a lot of gloves, hard for us to reduce use until infection control changes their guidance.
Yeah, this is a tricky one. I'm not an IPAC person, so I'm not going to say, yeah, go ahead and do it. But there are other systems, other health systems, and the largest one in the world in the UK that's doing this. So can we not learn where it's being done already and apply it here? That's really what I'm asking. And I sympathize with all the people that are identifying what they perceive as, an overuse of materials. And that's why we need to have and continue these conversations, because change isn't going to happen individually. We've got to demand it together.
I think that brings us to the end of time. So I just wanted to say thank you to everyone who helped us get here. We're grateful for our funding support from Environment and Climate Change Canada. And in the last slide, we have Linda and Mia's email addresses. You can contact them for any questions that you have about the project. I will note that we have some unanswered questions. We will do our best to answer them. And we will be sharing a recording of the presentation with anyone who has registered. So you will be getting that. And once the webpage is available with the full video, the guide, we will also let you know. But if you have any questions in the meantime, please do let us know, and feel free to email us. And thank you so much for attending. We appreciate you for coming out.